Every day, 4 women are diagnosed, but sadly, every day 3 women pass away from ovarian cancer. It's only a 46% survival rate beyond 5 years, and that hasn't changed for about 30 years. I feel that if I can have my voice contributing to bring change and bring hope, and also change that statistic in the future, that means so much. So it's a group of either 3 or 4 women presenting, or carers, and there is a facilitator. And so we go to universities, to nursing schools, and also to hospitals, and talk with medical students, nursing students, about our journey through ovarian cancer.
Obviously, carers are heavily involved in the treatment of the women with ovarian cancer. So with the doctors and the people and the consultants who are talking to us, it's really important to understand the role of the carer, understanding that you're not just talking to the patient, that you're talking to a family.
And also to understand that patients have their own difficulties dealing with the medical system, and that how they relate to their doctor and how effective their doctor is at listening can go a long way to simplify or to smooth all that complexity in the health system. Because there's actually pretty good hard data that health systems are more efficient and cost-effective when doctors communicate well.
To know that we are more than just a diagnosis, we're a complete person who has a family and who has, I guess, a life to live. And so to enable them to be able to diagnose better and also deliver the care in a more holistic way.
It's a tricky disease to pick up, but we want to improve where we are at the moment.
Yeah, so it's really important for doctors and the health carers to understand the signs and symptoms, because if ovarian cancer is picked up in the earlier stages, it's a lot easier to treat, and the outcomes, the survival rates will be a lot better.
But also to listen to the ladies, they've got a lot to say. It's their experience, it's their body, and to believe. And not to question, but to understand where they're coming from.
If you're interested, curious, and you listen, and you think about it from how the patient might be going to hear it, then you're going to go a long way to helping with this.
I would love to encourage women and their carers to get involved with Survivors Teaching Students. It's a wonderful program where you share your story and you feel that you're really helping to make a difference.
So it gives me a personal sense of competence and relevance, a lot of which can be undermined when you lose your capacity through having gone through cancer.
It's a real additional purpose to life that I feel that I can help save other women's lives, help the quality of their life, that journey can be made with a much better prospect for women in the future.
To be able to share the story does give a bit more clarity. Some of the stories are not great, some of the stories are quite sad, but the stories are the stories, and we're made up of stories, and they're all extremely important.